On this Saturday night, turbulent times at Air Canada. The struggling carrier plans to lay off more workers. Will the federal government bail out the airline industry?
We are going to need airlines afterwards.
Who will pick the produce? The demand for seasonal workers in Canada. Plus, limits on vaping, new restrictions on e-cigarettes, and the future of concerts. Can the show go on somehow?
Global National with Robin Gill.
Good evening and thank you for joining us. We begin tonight with the unprecedented toll COVID-19 is taking on the travel industry. Air Canada says it will have to lay off 20,000 employees, more than half its workforce. Travel has tanked with countries shutting down, and the entire global airline industry is in trouble. As Mike Drolet reports, the Prime Minister still hasn't offered a bailout to Canada's airline sector.
With no end to the pandemic in sight, the airline industry is looking for a lifeline. At Air Canada, it can't get much worse, with layoffs affecting 20,000 staff next month.
I think we reached the bottom for sure. So, are we going to dig further down?
To that end, all eyes were on Prime Minister Justin Trudeau at his daily media briefing. But when asked about the airline industry, he offered nothing.
In all sectors of the economy, but certain sectors have been hit even harder. That's why we're going to keep working with various sectors. We're going to continue to work with sectors.
His non-response was met with frustration from industry insiders who have seen every other G7 country come up with measures to support their domestic aviation sector.
Have they got a master plan? Have they got something, if they indicated that they had that, it would be reassuring. We have no indications that they have any direction in what they're doing other than putting out fires.
Trudeau was asked about a bailout similar to the one in the U.S. and nationalization, as Italy has done with Air Alitalia. Again, he offered no response other than to point to wage subsidy programs already in place.
I don't have the crystal ball and I cannot tell you what is realistic or not, but we're going to have to find the solutions because we need them. We're going to need Air Canada, right? So nationalization is a possibility. Getting some private equity into it, why not?
But who would be willing to buy into the industry right now? The Montreal-based International Air Transport Association has painted a grim picture, with travel dropping 90% in Canada, the U.S., and Europe. It's estimating passenger traffic won't rebound to pre-crisis levels until at least 2023, and even later if restrictions are extended. Another issue for Canadian airlines is only the largest qualify for the government loan program, leaving smaller airlines vulnerable, which would create an even bigger problem.
Most important is that in many, many regions, there's no other way to connect to those regions than through the smaller airlines. The large airlines are key to our economic development, but the smaller airlines are a lifeline to many regions.
Merci beaucoup tout le monde.
If Trudeau has a plan in the works, he hasn't said, leaving the airline industry financially grounded. Mike Drolet, Global News, Toronto.
Families across Canada are also struggling, and this month there will be more financial help for those with children. On Wednesday, those eligible for the Canada Child Benefit will receive an extra $300 per child as part of their regular May payment. And in the summer, Ottawa will give families another boost to help with rising costs.
Starting on July 20th, we will increase the Canada Child Benefit once again for the upcoming year. Every summer for the past 3 years, we boosted the CCB to help keep up with the cost of living. This summer will be no different.
That will raise the maximum benefit to just over $6,700 per child under the age of 6 and just under $6,000 per child aged 6 through 17. The government has also allocated $40 million to help women fleeing domestic violence. Today, the Minister for Women and Gender Equality said the money is being shared among 500 shelters, as well as centers supporting victims of sexual assault. The federal government also committed $15 million to support female entrepreneurs to help their businesses through the economic crisis caused by COVID-19. The funding will go directly to organizations that are already part of the government's Women Entrepreneurship Strategy Fund, which provides support for women who want to start or grow a business. Health Canada has approved the first clinical trial of a COVID-19 vaccine. Human trials will begin at the Canadian Centre for Vaccinology at Dalhousie University in Halifax. The National Research Council of Canada has been working closely with CanSino Biologics in China, which created the vaccine using living cells grown by scientists here in Canada. That research is in the second phase of human trials. According to the World Health Organization, there are about 100 other potential vaccines that are in the early stages of development.
I think this is just the first of a number of them, and that's very important to have multiple vaccines going through the process because we need to have that redundancy. Not all vaccines ultimately will work, and in order to make sure that we have more than one that works, we need to be studying a number of vaccines.
And here's the breakdown of cases in Canada. There are more than 75,000 confirmed cases of COVID-19 across the country. About half have now recovered from the new coronavirus. Across Canada, more than 5,600 Canadians have died. Quebec remains the hardest hit province with more than 42,000 confirmed cases and more than 3,400 deaths. A new COVID-19 outbreak has been confirmed at another Canadian food processing plant. At least 3 people at the Oppenheimer Group fruit and vegetable plant in BC have tested positive for the virus. The facility remains open and public health is investigating. Canada's fruit and vegetable growers have been hit hard by the pandemic. Not only are they facing financial losses, but as David Akin explains, they're now facing a new problem, a labor shortage. David?
Well, Robin, the country's fruit and vegetable farmers are saying that the Canadian workers they would normally hire in the spring are preferring instead to stay at home and collect the Canada Emergency Response Benefit, or CERB. The CERB pays $2,000 a month. And given the choice between taking a CERB check, picking up seasonal work on a farm, or taking a full-time job in one of Canada's food processing plants, many Canadians are choosing to take the CERB. And that's causing a big problem for the country's food producers.
There is still a critical shortage of workers on some farms.
Companies that operate the country's food processing plants told a House of Commons committee on Friday that they've got 10,000 vacant jobs they cannot fill.
The CERB has created unintended consequences in the short term for many packers, distributors, wholesalers, and small retailers, who are facing greater challenges to hire at a time when Canadians are relying on them to provide the food they need.
More than 7.5 million Canadians are receiving the $2,000 a month CERB. To get that benefit, a recipient cannot earn more than $1,000 a month. Going to work on a farm or in a plant would put them over the limit.
The Canadian Emergency Relief Benefit, or CERB, has had an adverse impact on members' ability to fill positions. So we wish to partner with the government on a program to help incentivize Canadians to work in our industry.
Food producers also rely heavily on temporary foreign workers to plant and to harvest. The industry says that Ontario and Atlantic producers have received just 3/4 of the foreign workers they normally employ at this time of year, while Quebec and BC farmers have received barely half of the foreign workers that they need. And producers are now warning that because there were not enough hands on the farm this spring, there may be a shortage of Canadian fruits and vegetables this fall. Robin?
David Akin in Ottawa. Thanks, David. The World Health Organization has issued an alert about a dangerous condition affecting children that may be linked to COVID-19. Doctors are being urged to look for pediatric multisystem inflammatory syndrome. In the past few weeks, there have been reports of kids being admitted to hospital with symptoms similar to Kawasaki disease and toxic shock syndrome. It's believed this syndrome may be related to COVID-19. The WHO says there's an urgent need for more clinical data. In the United States, Donald Trump is downplaying the threat of new outbreaks as states reopen restaurants and bars. The U.S. president insists the nation has to rebuild its economy while promising a vaccine by the end of the year. The House has passed another economic aid bill for struggling Americans. But the Republican-led Senate says the bill is dead on arrival. Here's Jennifer Johnson.
From the Grand Canyon to some California restaurants.
It's like Christmas Day.
And even casinos in Oklahoma.
I'm pretty excited to get out of the house after 2 months.
Almost every state in America is reopening, at least partially, including some regions and popular beaches in the hardest hit states like New York and New Jersey, as hospitalization rates continue to go down. Lawmakers still urging social distancing.
We're right about where we were when we started. We just don't want to make sure we don't go back to the hell that we've gone through.
U.S. President Donald Trump is urging states to get back to business, even though just 3% of the population has been tested for the virus. Every day last week, over 1,000 Americans died of COVID-19. But the president is now predicting hundreds of millions of doses of the yet-to-be-developed vaccine by year's end, even while many health experts say that's unrealistic.
We'd love to see if we could do it prior to the end of the year. I just want to make something clear. It's very important. Vaccine or no vaccine, we're back.
The president also saying the coronavirus may just disappear without a vaccine. And he's still not wearing a mask, despite a Food and Drug Administration alert that the test kit used at the White House and elsewhere may be missing up to half of all positive cases.
The HEROES bill is passed.
Meanwhile, there's a new showdown between the president and House Democrats, who late Friday passed another economic aid bill, this one with a $3 trillion price tag, to help the unemployed, renters, and homeowners make ends meet.
For their health, for their lives, for their livelihood, and for our democracy, we couldn't be thrilled.
The Democrats' bill would give each taxpayer another $1,200, but President Trump says there's no way he's signing it. Jennifer Johnson, Global News, Washington.
The U.S. still has far more cases of COVID-19 than anywhere else in the world. It's now closing in on 1.5 million cases and over 88,000 deaths. The U.S. accounts for more than 30% of the world's 4.6 million cases. Globally, 310,000 people have died from the virus. Russia just recorded its highest daily death toll, with 119 new fatalities in the last 24 hours. In Spain, health authorities reported 102 new deaths. That's the lowest number of deaths in a day since mid-March. Italy has also recorded its lowest number of deaths in a 24-hour period since early March at 153. That government is now starting to ease travel restrictions. Starting Monday, people will be allowed to move freely inside the region where they live. And as of June 3rd, international travel will be allowed. Italy imposed a nationwide lockdown in early March after it became the first country outside of Asia with a major outbreak of the virus. Coming up, new restrictions on vaping, plus the travel restrictions separating newborns and their parents. Health experts say smokers and vapers are at much higher risk of contracting COVID-19. Smoking damages the lungs, and that weakness allows the virus to thrive. Nova Scotia has introduced Canada's toughest anti-vaping legislation by limiting the amount of nicotine levels in e-cigarettes. As Ross Lord reports, that province is leading the charge to protect young people from becoming addicted and suffering harmful side effects.
Nova Scotia is capping nicotine content in e-liquids at almost 2/3 lower than many current vaping products. The government says the new limit will protect youth in the province from the harms of nicotine, and smoking opponents agree.
Having this maximum nicotine level of 20 milligrams per milliliter will make these products less addictive. It's going to reduce youth vaping. It's something that's been in place in the European Union for several years.
Nova Scotia is considered a leader in vaping restrictions, but all provinces are taking action. BC is also limiting nicotine to 20 milligrams per milliliter and raising taxes. Alberta is hiking taxes and reviewing smoking legislation. Saskatchewan and Manitoba are restricting the sale of vaping products to people 18 and older. In Ontario, sales are confined to specialty stores. New Brunswick and Newfoundland and Labrador are limiting sales to people 19 and older, and PEI has raised the legal age to buy tobacco and e-cigarettes from 19 to 21, the highest age limit in Canada. In addition to Nova Scotia's new nicotine limits, it was the first in Canada to announce a ban on flavored e-cigarettes and juices. Before the pandemic, vaping was a growing public health issue attributed to dozens of deaths in the U.S. and more than a dozen cases of lung illness in Canada. Although medical researchers cannot yet prove vaping is connected to serious illness from COVID-19, they say there are other risks.
When someone vapes and emits the secondhand vapor to someone next by. Those droplets can transfer to someone else and they can get infected because of that.
Doctors say there's still more work to do, like preventing online suppliers from violating the new rules and educating consumers.
I really want to see us working on a public awareness campaign and educating youth in particular who have really sort of launched into this idea that it's out there and commercially available, therefore it can't be that bad for you.
The Canadian Vaping Association says it agrees with the cap on nicotine levels, but it wants Nova Scotia's flavor ban amended and taxation restructured. The new restrictions take effect in September. Ross Lohr, Global News, Windsor, Nova Scotia.
Families beyond borders still ahead. The parents blocked from their babies due to COVID-19. Some babies born to surrogate mothers in Ukraine have been stranded. Their parents, who are foreigners, can't get into the country because the borders have been closed. Now they're appealing to the Ukrainian government to help end the heartache. Here's Redmond Shannon.
Bundles of joy in an age of anxiety. Dozens and dozens of temporary orphans. The full closure of Ukraine's borders means no one knows when these newborns will meet their parents. We tried to send parents pictures, says the clinic's owner, but it cannot substitute any direct contact. The company's lawyer says Ukraine is only granting access to parents from countries whose embassies apply for special travel exemptions.
And we ask other countries to make an exception from their policy and to let their citizens unite with their children.
The parents who have made it are stuck in quarantine for 2 weeks.
It's very difficult. It's very difficult.
With most flights cancelled, one Swedish couple needed a private jet.
There was an anonymous sponsor that wanted to pay for our flight down to Kiev. Incredible.
Yes. There are currently 51 babies awaiting the arrival of their parents. But if the lockdown continues as forecast, the number of babies could reach 1,000, according to Ukraine's human rights ombudswoman.
Загалом-то в Україні понад 100 дітей.
She suggested a change in the law to ban foreign surrogacies in Ukraine. Prospective parents go there because of those laws and the cost, significantly less than in Canada.
There have been difficulties, challenges for many parents in various countries with bringing babies home from countries like the Ukraine and Georgia, Russia. That has been an ongoing problem.
Cindy Wasser specialises in fertility law and says Canada remains one of the best places for surrogacy.
What I would like to point out is for those in the future to consider what and where they will go and what they will do to choose something better so they're never in this position again.
Ottawa is allowing entry to foreign parents who have a surrogate baby born in Canada as long as they are not showing COVID-19 symptoms. In Ukraine, these tiny miracles remain oblivious to the heartache their parents are feeling. Redmond Shannon, Global News, London.
The shows can't go on. Up next, the uncertain future facing the music industry.
Well, I suppose all parents wondered how things would have changed if they had a different child.
I didn't mean a different one.
Fred Willard has been making audiences laugh with his distinct brand of comedic acting on hit shows like Modern Family and screen favorites like Anchorman. He started his career in the famed Second City comedy troupe. He was a fixture in mockumentary-style comedies like This Is Spinal Tap, Waiting for Guffman, and Best in Show. He's set to appear in the new Netflix series Space Force later this month. His family says he passed away last night of natural causes. Fred Willard was 86. From lockdown sing-alongs on balconies to virtual choirs, we've seen people around the world turn to music during this pandemic. But the music industry is facing its own crisis as the list of canceled shows continues to grow. Nadia Stewart reports.
The Rolling Stones were set to play in Vancouver in May, but the band canceled the show, adding to a list of live shows not hitting the stage this year because of COVID-19.
We're in uncharted territory, so
Paul Runnels is the co-owner of a company behind many of BC's live shows. He says the economic loss from major events like it cannot be understated.
That event alone is $150 million of economic activity on an annual basis. So you look at something like that, and then you think about, the numbers of concerts and arena shows and stadium shows, and I mean, it multiplies up very, very quickly.
Instead, we have decided we are going to play a show to nobody. Maybe can we swirl the camera around and show this, just a handful of people here.
Vancouver musician Dan Mangan had shows lined up for the spring and summer.
And I have another sinking feeling that spring tour is going to get postponed once again until next fall.
Now he's looking at how to effectively host concerts online using a platform he helped create. He says concerts of the future have forever been changed because of this pandemic.
I see long after COVID, this behavior will continue. And I think that what you'll start to see is that you could attend a show in person for, one ticket tier, and then maybe for a much lower ticket tier, you could also stream it from home.
In a survey earlier this week, over 50% of Vancouverites said they would not go to a live concert or sporting event again unless there is a vaccine. Runnels says there are many artists longing to be back on stage, but the uncertainty means when that will happen.
We don't even know what that calendar looks like. Is it starting in the fall? Is it starting, in the winter? Is it starting next spring? Is it starting next summer?
With the uncertainty of this virus, that's anybody's guess. Nadia Stewart, Global News, Vancouver.
And that is Global National for this Saturday. I'm Robin Gill. Remember Captain Tom Moore, the British vet whose 100th birthday goal of 100 garden laps raised millions for the healthcare system. Tonight, one Canadian was inspired to one-up him. That marks 101 laps for 101-year-old John Hillman. But it's not stopping him. The war vet plans to keep walking and fundraising for 2 more weeks. So far, he's raised over $140,000 for Save the Children Canada. Thank you for watching. Good night.